Okay, I can go ahead. Okay. Good afternoon, everybody. His voice is okay. Good afternoon, everybody. Myself, Dr. Sandeep Reddy Ganta. I'm a consultant endocrinologist at Kamineni Hospital, LV Nagar. Today, I'm going to talk about one of the important topic in the current scenario, that is diabetes in young adults. So, diabetes in the young adults is defined as onset of any form of diabetes less than 40 years of age. Diabetes is a chronic metabolic disorder characterized by chronic hyperglycemia, that means increase in the blood sugar, which is causing the disturbance of metabolism of fat, carbohydrate, and protein metabolism. So it is due to mainly insulin deficiency, that is absence of insulin, are due to insulin resistance, where insulin are unable to pump the blood into the cell. It is called insulin resistance, or both. So usually the diabetes in the young, previously we thought that mostly in the children's and adolescents it was a type 1 diabetes, but nowadays current scenario is changing because of increased childhood obesity. The number of type 2 diabetes cases are increasing. So type 1 accounts for almost 40% of cases of type for diabetes cases in the children's, whereas type 2 also accounts for 40%, and rest of the diabetes caused by genetic diabetes, that is maturity onset of diabetes of young, that is MODY, and chronic FCPD, chronic fibrocalculous pancreatic disease, is the other common causes, and the very rare causes will be like mitochondrial diabetes. I'm going to discuss about all types of diabetes. First one is type 1 diabetes. Type 1 diabetes, we thought it is the most common in the children and adolescents, and we don't see any, we thought we don't see any other type of diabetes. This type 1 diabetes is due to mainly autoimmune destruction of beta cells, which is characterized by formation of antibodies against the beta cells, which leads to absolute insulin deficiency. So patients will require a lifelong insulin therapy for management of this type of diabetes. So this type of type 1 diabetes will present with acute presentation. They will have osmotic symptoms like polyuria, means increase the passage of urine. Polydipsia means increase intake of water and the weight loss, and increase intake of food will be there, that is polyphagia will be there, and increase recurrent infections will be there. These patients will require mainly insulin for the control. Sometimes they present with a very acute condition called diabetic ketoacidosis, where chronic severe hyperglycemia leads to formation of ketone bodies, which are derived from fatty acids, which can lead to the acute complications which require the admission for the treatment. Then this type 1 diabetes risk factors will be, most of the time it is due to, there is no particular reason. It may be due to genetic problems, like genetic disorders like HLA genes are may be responsible for the type 1 diabetes. Environmental factors like viral infections and cow milk allergy are sometimes familial, might be there. And treatment will be only insulin therapy is the treatment of choice for type 1 diabetes. And type 1 diabetes not only will occur in the children's, but also it can occur from any age, from children to the adults, and even in the older age also it can be occur in the type 1 diabetes. Next most important is type 2 diabetes. Usually it is a very less common previously in before 1990s and 95. Now the cases of type 2 diabetes are increasing in the children and adults with less than 40 years of age. Usually type 2 diabetes onset will be around the 5th or 6th decade of previously, Now there is a paradigm shift in the onset of type 2 diabetes. That is the diabetes occurring at the age of 32, even 20 years also. Even children with our type 1 is more, but even the patients of type 2 diabetes also increasing. And why there is a increase, recent trends in the increase of type 2 diabetes in the adult age group? There is a several reasons are there. One thing is environmental factors, like increase in the changes in the lifestyle. Changes in the lifestyle means there is a globalization, like urbanization of leading to the increased availability of food, which is availability of fast food, and change in the lifestyle leading to the obesity. So most of the children, adults are rather than they will stick to the TV, laptop, or any cell phone, which can lead to increase the obesity. And most of the schools and colleges will concentrate mainly on the education rather than not focusing on a physical education. So increase competitive exams and long hours of study also leads to this kind of obesity. And genetic factors, like presence of family history of diabetes, which can also lead to the increased incidence of type 2 diabetes. So this family history, these genes will be there, these called 35 genes. These are usually used to store the food. They are responsible for fat storage, so they are maladaptive in the availability of food, excess availability, which can lead to the obesity. Normally Indians will have a more visceral fat and more metabolic problem compared to western countries at low weight. Normally in western countries, if you compare the western countries from the Indians, the visceral fat will be more in the Indian at the same weight. It is called YY phenotype. That's why at Indians, especially South Asians, at low weight also, they are increased risk of developing a type 2 diabetes. So that's why the because of unplanned increased economic activity and urbanization can lead to a more availability of food, and which can lead to obesity and leading to the onset of type 2 diabetes at early age. Why it is more important onset of type 2 diabetes at younger age? One most thing is presence of morbidity and mortality is more with the onset of type 2 diabetes at early age, because this type 2 diabetes will also characterized by other abnormalities like hypertension, dyslipidemia, which can increase the risk of both macrovascular complications like cardiovascular diseases, and also microvascular complications like kidney diseases and retinal disorders and neuropathy complications. So these young onset of diabetes, type 2 diabetes especially, increase the risk of cardiovascular diseases. So because they exposure to the other complications like hypertension and dyslipidemia, and also other complications like microvascular complications, retinopathy, neuropathy, and nephropathy also will be more, because they have a long duration of diabetes. They will expose to the long duration of uncontrolled hyperglycemia. Other implication will be in onset of type 2 diabetes will be there is a early loss of beta cell function will be there. So early loss of beta cell function means patient will lose the effectiveness of oral hypoglycemic drugs that are prescribed for the onset of type 2 diabetes, at the onset of diabetes. So it can lead to the early failure of oral hypoglycemic drugs. So they will land up in the insulin at a very early stage. The symptoms of these diabetes, like type 2 diabetes, they don't have any initial symptoms. Usually they are identified on the screening. The sugars are very high. They will have symptoms like polyuria, means increased urination and increased intake of food, and weight loss will be there. And there is a recurrent fungal infections like tinea in the groin or anything, and a recurrent UTA will be there. And there is a tingling numbness in the both lower limbs and upper limbs will be there. You can identify basing on the symptoms. So how do you diagnose these type 2 diabetes? This diagnosed by same criteria which you use for adults or older adults, like fast RBS, random blood sugar more than 200 with osmotic symptoms like polyuria, polyphagia and polydipsia, and fasting blood sugar, that is before breakfast the sugar more than 126, and after taking a 75 grams oral glucose the postprandial sugar more than 200, if and HbA1c, that is average blood sugar over 3 months. If the HbA1c more than 6.5, it is considered as a diabetes. Out of 3, 2 should be positive to diagnose the type 2 diabetes. So the type 2, these type of type 2 diabetes require the early screening. Means early prevention is most early diagnosis are most important to prevent the long term complications of micro and macrovascular complications. So whom should we screen for type 2 diabetes in young adults? So you are overweight and obesity. Overweight and obesity is defined as if BMI is more than 85th percentile, or overweight if it is BMI more than 95th percentile, defined as overweight. And if there is a family history of diabetes, especially type 2 diabetes, it is also risk factor for type 2 risk factor for early onset type 2 diabetes. And also presence of cardiovascular disease, also you should screen for type 2 diabetes. Presence of hypertension and dyslipidemia, and signs of insulin resistance like central obesity, and presence of acanthosis nigricans, which means presence of blackish discoloration over the neck, which is velvety appearance with a black color discoloration over the neck and the groin and the axilla, which is called as sign of insulin resistance, should also screen. And if the first degree relatives with a type 2 diabetes, you should screen. So screening test, as I told you already, fasting blood sugar more than 126 and after 75 grams OGTT, 2 hours blood sugar more than 200, and if HbA1c more than 6.5, all should be screened. And the screening age of the children should start at the age of 10 years or at the onset of puberty, whichever is earlier. If the puberty onset is earlier, should start screening from that age. And the frequency of screening should be every 3 years. If the patient have a risk factors, you have to screen for type 2 diabetes. So what are the treatment options that are available for the type 2 diabetes, which is mainly dietary advice and exercise. And dietary advice, which mainly consists of low calorie diet, means less than 500 kilocalories of normal intake of food, that is approximately 20 to 25 kilocalories per kg per day. You can take vegetables, green leafy vegetables and the millets and oats, and you should avoid maida and artificial flours, and you have to avoid the junk food like pizza, burger or anything. And you have to replace the white rice with single polish or brown rice or any other rice you can replace, but you should not take white rice, white bread and white pasta, and the items made up of maida you should not take. And your most emphasis on the fruits, and at least diabetic patients should take at least 2 times consumption of fruit is recommended. And exercise, you have to do exercise at least 30 minutes per day for at least 30 minutes per day, and 150 minutes per week is recommended exercise. And other will be pharmacological therapy like oral hypoglycemic agents and insulin are recommended for this type 2 diabetes patient early onset. The glycemic control, strict glycemic control is recommended to prevent the long term complication, because the HbA1c should be less than 6.5 to prevent the any complications. Next, how to prevent this early onset type 2 diabetes in young adults. So this form of diabetes is preventable even if you identified the early stage, or even if you identify the at the pre-diabetic stage. That is, if the HbA1c from 5.7 to 6.5, called IGT, or pre-diabetes is this will increase the risk of future type 2 diabetes. If you identify the any patient by the screening with the already discussed risk factors, you can reverse the diabetes by changing the lifestyle and dietary modification and exercise. So coming to the prevention is like primary prevention. Primary prevention will be applied if the patient doesn't develop any form of diabetes, and patient at the risk of type 2 diabetes in the presence of family history or hypertension, dyslipidemia, PCOD in the girls, and history of GDM is there, then patient is at risk of developing type 2 diabetes. So you can advise lifestyle changes. So lifestyle changes will be not only a diet, it will be like considering the exercise, and exercise for adults will be different, and children's you ask them to play at least 30 minutes to 1 hour. You can ask them to play, and emphasis on mainly on the green leafy vegetables, fruits, and all cereals you have to take, or in the form of whole grains you have to take, and to avoid all the junk food for a prevention of type 2 diabetes. And I'll sleep for 8 hours, and avoiding the stress, and avoiding the smoking and alcohol is recommended for primary prevention of this kind of type 2 diabetes in the young adults. And secondary prevention will be after onset of diabetes. If the patient is identified at the early age, you can reverse the diabetes by having a weight loss up to 10% of body weight loss causes a reversal of diabetes, which prevent the long term complication of diabetes. And by pharmacological therapy or insulin, if you are able to achieve the good glycemic control, you can prevent the long term complications. So there is the interventions also at required at community level and the school level and at a government level. Community level, you are educated about the mass education is required for a healthy lifestyle and regarding exercise. And at the school level, it's the most best medium for addressing the childrens and young adults. Like you have to train the teachers for a healthy lifestyle, and inclusion of games in the school curriculum is important, and avoiding the fast food chains near the school is recommended for the prevention of this kind of type 2 diabetes. And government at government level, there is a change of policies required for this fast food center, and healthy and unhealthy foods are recommended for at the government level. So these are the type 2 diabetes. In short, type 2 diabetes, we thought it may be occur at 50 to 60 years. It is occurring below 30 years, which leads to the increased mortality and morbidity at the young age, which is causing an economic burden to the country. So in this type 2 diabetes, there is a faster decline of beta cell function leading to the insulin dependence, and there is a more risk of complications like nephropathy, retinopathy, and macrovascular complications like cardiovascular disease is there. So other type of diabetes which is very less commonly seen is a maturity onset of diabetes of young. That is maturity onset of diabetes young is the presence of strong family history. That is, at least three generation of family should be affected, like grandfather, father and son should be affected. All should have a onset of diabetes less than 20 or 25 years of age should be there. So these genetic diabetes not related to any form of obesity, because of genetic defect they are going to develop at the young age. Identification of these modi is beneficial, because there is a different type of manifestations will be there for different type of modi. So that modi 1 to 7 kind of genes will be there. So if you identified some modi forms some maturity onset of diabetes of young will require only oral hypoglycemic drugs for the control of sugar. Sometimes it is misidentified as the type 1 diabetes. For Modi, there is a age of onset should be around 20 to 25 years, and there is a strong presence of strong family history suggestive of Modi, and there is a absence of insulin resistant signs like acanthosis, hypertension, and dyslipidemia should not be there, and presence of insulin secretion which can be identified by presence of C peptide level, and absence of antibodies. Presence of antibodies which tells you about type 1 diabetes, whereas absence of antibodies will should evaluate for MODI, this maturity onset of diabetes of young. And other kind of diabetes will be FCPD, that is fibrocalculus pancreatic disease, which is also commonly seen in the tropical countries like South India, sometimes in the West Bengal. So this is characterized mainly by pancreatic diabetes, where initially they require oral hypoglycemic drugs for a control of diabetes. Later they require insulin. This FCPD characterized by pancreatic dysfunction. Exocrine pancreatic dysfunction means they have a pancreatic enzyme loss, which is characterized by increase in the fat in the stools also will be there. And this is mainly due to malnutrition. It is called sometimes called as a malnutrition related diabetes because of micronutrient deficiency and excessive consumption of cassava roots, and some other maybe due to genetic problems patient will develop SCPD. It is diagnosed by presence of intraductal calcification in the pancreas, which is identified by the X-ray. So, what is the implication of FCPD is they are going to develop more pancreatic carcinoma than other form of diabetes. So, they require the screening for this pancreatic diabetes. And other very rare diabetes will be mitochondrial diabetes, which is a very less common. Its presence of family history indicate that mitochondrial diabetes. So, okay, 20 minutes. ఇంకేమన్నా కంటిన్యూ చేయమంటారా సార్? So thank you for listening this young onset of diabetes in the diabetes in the young adults. So no, it is not visible. Yeah, not visible. Input is not supported now. So here questions. Yeah. So diabetes, mainly type one diabetes, we cannot do anything. For MODI also, we cannot do anything. For type 2 diabetes, which is a preventable, mainly to reduce the onset of diabetes, you should not become obese, and by changing the lifestyle and exercise, you can reduce the incidence of type 2 diabetes. So as I already told you about dietary advice and exercise and avoiding the stress and sleep for 8 hours will prevent the onset of diabetes. So diabetes going to the effect of diabetes in the male fertility is very less. So patient who has an uncontrolled hyperglycemia, they have more chances of abortions in their partners because of formation of free radicals, which are going to affect the sperm quality and motility. So they require more strict glycemic control. As such, there is no much effect of fertility, but a long duration of diabetes will causes erectile dysfunction, and sometimes if the lack of sugar control will also leading to the hypogonadism, means there is a decrease in the male hormone which can lead to decrease in sperm counting. Overall fertility is not much affected, but very severe uncontrolled hyperglycemia and long-standing diabetes might going to affect the male infertility. So diagnose by only by screening. So already I told that fasting blood sugar, you have to do fasting blood sugar. You have to do OGTT, that is 75 grams. After taking a 75 grams anhydrous oral glucose, you have to test for postprandial sugar. And one more thing is HbA1c you have to do. Basing on that, you can identify the diabetes at early stage.